Hello, I am Dr. Sohini Chakrabarti, ENT and cochlear implant surgeon practicing in Bangalore. I completed my MS ENT more than 5 years ago, and after that I have cleared MRCS ENT from the Royal College of Surgeons, London. I further went for a fellowship in cochlear implant surgeries, where we take special interest in treating pediatric deafness, that is children who are born deaf, and also adult patients who have lost their hearing by cochlear implant surgeries, which is one of the latest technologies in the field of ENT. I have worked in Bangalore and across India in various government hospitals, trust-run hospitals as well as corporate hospitals, and in my clinic I provide all the ENT services like checking your ear, nose, throat, your hearing tests, endoscopies of the nose and throat and ear, which is an integral part of diagnosis of any ENT problem in a modern ENT setup. We also run special OPDs for the hearing impairments in children and adults, where counseling for cochlear implants and further advanced audiology tests for cochlear implants are conducted. After cochlear implant surgeries are done, the rehabilitation, that is the auditory verbal therapy or AVT, in simple terms what we know as the speech therapy, for over 1 year post surgery is also undertaken. I am attached to various corporate hospitals in Bangalore: Manipal Hospital, Varthur Road; Malia Hospital, now known as Vaidehi Super Speciality Hospital on Vittal Malia Road, and my clinic in KR Puram on Devasandra Main Road, opposite to Venugopala Swami Temple at Manjunatha Hospital, where you can see me daily from Monday to Saturday in the evening hours. Today, we will talk about a very common yet alarming ENT problem, that is nose bleeding, known as epistaxis. When anyone at home faces nosebleed, we all get very scared. First thing we need to remember is not to panic. We make the patient comfortable and ask them not to panic at all. We should not ask the patient to lie down. That is a major mistake most of us do. The patient needs to sit up, bend their head down. All you need is a piece of cloth or towel. You need to pinch the nose of the patient tightly with a towel and ask them to slowly breathe through their mouth. In the meantime, arrange for some ice packs to be applied over the nose and cheeks. This to a large extent stops nasal bleedings. 3 to 5 minutes is what it takes to stop a nasal bleeding. But even after that, if the bleeding continues, it is profuse, you need to see an ENT doctor urgently. Common causes of nasal bleeding can be nose picking by children, which is one of the most common things we see in our everyday practice. Some elderly patients who are having high blood pressure or are hypertensive due to uncontrolled rise in BP can lead to severe nose bleeding. These are cases which need to be hospitalized urgently, and nasal bleeding needs to be stopped by packing or by endoscopic cauterization. Foreign body insertion in the ear, nose or throat. You may have come across anyone, or your own child may have put a foreign body, for example a peanut or a small piece of crayon or a paper piece or thermocol balls into their nose, ear, or even swallowed a piece of coin, which is quite common. Not to panic here. Please, parents, do not try to take it out at home. The more we try blindly by inserting some hair pins, some safety pins inside the nose, ear, etc., we end up injuring the child's nose and ear further, and bleeding happens. Then when you take to an ENT doctor, he or she may not be able to see the foreign body at all. So in the first instance, instead of trying anything at home, please consult your nearest ENT doctor so that they can take it out easily with their instruments. Also, keep your child away from all sorts of small foreign bodies like crayons, like coins, like thermocol balls, paper pieces, even pulses, gram, peanuts or peas. If your child has swallowed a coin, this is something serious. You need to go to the hospital at the nearest opportunity, get an X-ray of the throat done. That is how we can find out where the coin is lodged. If it is in the food pipe, then it can be taken out by a surgery. Hearing loss in children. The common causes which are there and their remedies. Do you know the most common cause of hearing loss in a child can be earwax? Yes, you are correct. Not to use earbuds at home and try to push the wax further inside, or you can injure your child's ear canal and that leads to bleeding and infection. Please consult an ENT doctor who will advise some drops. After a couple of days, the earwax can easily be washed out and your child can be hearing once again. Another common problem in children is what we call glue ear or some fluid behind the eardrum. This can happen because of regular cough and cold or even enlarged adenoid glands behind the nose. Your child may be snoring at night or breathing through the mouth. This is because of enlarged adenoid glands. Not to ignore such problems, consult your nearest ENT, get your adenoids treated as well as give the child a good hearing for better speech and language development. The causes of congenital hearing loss, that is, children who are born deaf. This is a serious issue. Many of the children who are born in India are not screened at the time of birth of any hearing loss. The hearing loss on both the ears can be due to various causes. For example, during pregnancy, if the mother is suffering from any kind of viral infection, fever, which we often tend to ignore, can lead to hearing loss in your fetus or in the child during pregnancy period itself. If the mother has taken some long-term medication, some antibiotics, which also can hamper the child's hearing. Some children who undergo a difficult delivery, who do not cry immediately after birth, who are born preterm, who have low birth weight, who have been admitted to the neonatal ICU or the high dependency units for a long time after their birth, maybe due to jaundice or other serious reasons, can be the victims of hearing loss. We should not ignore this at all. If your child has been tested for hearing loss immediately after birth before you leave the hospital, well and good. Otherwise, please get your child's hearing tested at the earliest possible opportunity by an ENT surgeon and an audiologist. If you find your child unresponsive to sound, for example, by the age of 4 months, they do not look when you call, they do not respond or blink an eye even to very loud sounds in the room, that may be an alarming sign. By the age of about 10 months to a year, a child should be responding to his name. If you call him by his name from behind, he or she should be looking at you. If these signs are not present, it's high time you get your child's hearing tested for a better future, because nowadays we have very advanced technologies like cochlear implants which can help such children with major hearing defects to lead an absolute normal life and be integrated into the mainstream society. So do not deprive your child of a normal hearing and a normal life. Tonsil problem in your child. Don't you think it's a very common thing we come across? Very often our children may be suffering from repeated throat pain. Whenever I find parents coming to my clinic with the complaint that whenever my child takes anything cold, be it an ice cream or a juice, immediately they develop throat pain, fever, and it happens like more than 3 to 4 times, 5 times in a year. It is high time you get your child's tonsils checked by an ENT doctor if it is happening repeatedly for over 3 to 4 years, and if your child has something called chronic tonsillitis, it is time that you get it tested, treated, and if needed, removed by surgery. Nowadays, we have a very advanced technology called coblation method by which the tonsils can be removed by an absolute painless, bloodless technology in which the patient can be discharged from hospital from the very same day in the evening. The child is absolutely normal, eats well, there is no residual pain after surgery, and goes home happily. Next time you have an ice cream, there is no problem, there is no sore throat, and you lead an absolute normal life. So don't ignore the recurrent tonsil infections, get it treated by your nearest ENT. Snoring and mouth breathing. In children and adults alike, snoring is a big problem. In children, snoring and breathing through the mouth, getting recurrent cough and cold or ear pains can be due to something called enlarged adenoid glands behind the nose. Just like we have tonsils, a similar gland is present behind the nose in children up to the age of 12 or 13 years, known as adenoids. Very frequently, it becomes enlarged, becomes the seat of infection, and gives us the problems like snoring, inability to breathe through the mouth, recurrent ear pains. Don't ignore these signs in your child. Get it treated by the nearest ENT. We can treat it medically using some nasal sprays, or if it is really big and not responding, we subject them to a small surgery called adenoidectomy by latest technology called coblation method, which is an absolute bloodless and painless technology for removing the adenoid glands. Sinus problem. It's a very common problem faced by so many of us. What is sinusitis? Sinuses are basically air-filled pockets in our skull bones. Sometimes due to chronic nasal blockage, due to infections, allergies, the drainage of the sinuses into our nose gets blocked. This leads to infection and pus formation inside these sinus cavities. This is what we call as sinusitis. It can be acute when it happens over a short period of time, and it gives us severe headache, nose blocks, face pain, runny nose, cold, cough and fever. This can be treated very easily with some antibiotics, nasal sprays and antihistamine tablets. But if these things are happening to you over and over again, and whenever you have something cold, you are exposed to a cold atmosphere, immediately you get these problems of sinusitis. It is a chronic sinusitis for you, which can be due to bacterial infection or fungal infection. Get yourself diagnosed at an ENT center by doing a nasal endoscopy and perhaps a CT scan of the nose, which will bring out the real problem and you can get the required treatment. Hole in your eardrum. Many of you might be facing problems of pus or some liquid coming out from your ear, maybe suffering from hearing loss, yet you don't know what to do. It can be because of a hole in your eardrum and infection in your middle ear. The hole in your eardrum can be repaired by a very simple surgical technique called tympanoplasty. In this, we just close the eardrum and we can let you go on the next day of surgery itself. There is no major complications of this surgery, and it will not only give you a dry ear and relief from all ear infections, but it will give you a better hearing as well. Can earbuds cause problems to your ear? Yes, this is very true. Using earbuds blindly to clean your wax in the ear or to dry your ear after taking bath, please avoid it. We not only blindly keep scratching our ear, but we push the wax deeper inside, and sometimes we will cause injury to our ear canal. There may be bleeding, fungal infections, pus coming out of your ear, and the wax not only gets hardened, it gives you further pain. So avoid using earbuds at all costs. Go to an ENT, get some ear drops for your ear wax and get it cleaned by a professional person only. Snoring is nothing, it's harmless. Is it right or wrong? Snoring by itself can be harmless, but when snoring progresses to sleep apnea, you need to see a medical practitioner urgently. What is sleep apnea? It is break of or stoppage in breathing completely over 20 seconds during your sleep. This is called sleep apnea. It causes fatigability, daytime sleepiness. You tend to sleep off at any time during a meeting or when you're driving. It can lead to serious problems in the long run. It leads to a lot of metabolic diseases, including high blood pressure, including heart problems. So not to ignore the sleep apnea, get it treated by your ENT. You might be having a simple nose block because of bent bone or enlarged tonsils and adenoids, or you might be obese, you might have a short neck or a large tongue. These problems can be sorted out by an ENT. An ENT can diagnose your problems by doing a nasal endoscopy, a throat endoscopy, and will give you the appropriate solution to it. So do not ignore the signs of snoring. Allergies are only caused by dust. Is it a myth or a fact? It is a myth. Allergy can be largely due to dust exposure, yes, but there are tons of allergens in our own house or in the surrounding areas which can trigger allergies in us. A running nose, severe sneezing, getting up in the morning, blocked nose, headaches, even chest discomfort, breathing difficulties, itching in the skin can all be due to an allergy, either skin, nose or the lungs. They are all related. Common allergens include animal fur, our pet animals, birds, pigeons, use of talcum powder, use of deodorant body sprays, maybe a strong smell while cooking. Fungus is very important allergen which can be there as black molds on damp walls of your washrooms or kitchen. Cockroach is another very important allergen, and not to ignore the dust mites in our bed sheets, pillow covers. So regular cleaning of your bed sheets, pillow covers, curtains are very important. Avoid having any carpets at home for people who are allergic. Regular cleaning of your homes and surroundings are very important. Avoid having any flowering plants immediately inside your house because pollen grains are also a major source of allergen. A husky voice is only due to cold or an infection. It's not so. There can be a grave cause behind a husky or hoarse voice. Not to ignore any hoarseness in your voice which is lasting more than a week. Often, teachers, even sales personnel, or even our politicians who need to speak a lot, or any public speaker tends to have a hoarseness in their voice. This may be due to small vocal nodules or vocal polyps. Apart from that, another major cause of hoarseness is a growth which may be a cancerous or malignant growth in your vocal cords. This is very much important for people who are chronic smokers, habitual tobacco chewers. They need to be very careful about any hoarseness or change in their voice which is lasting more than a week. Get yourself checked by an ENT who does an endoscopy of the vocal cords to check your vocal cords. Severe pain in the chest at night or bleeding from the nose. A medical emergency can happen anytime to anyone. Medi-Talks are providing 360-degree of medical healthcare services, including free ambulance service all over Bangalore, which is very important for taking any patient to the nearest hospital at the earliest. Apart from that, they do free medical camps in your apartments in Bangalore, doctor home visits, home care services, and many more. Make sure you register with them for the best possible medical services.